Hello, Dr. De Souza. Welcome to the International Dentist Podcast.
Thank you. Thank you for having me. It's a pleasure.
I'm really excited to hear more about your story. We know each other, but I think that until the point that you sit down and talk about these things,
Yeah.
you don't even realize what someone's path has been about. So I look forward to hear your path a little bit more.
Yeah, I mean, hopefully I can, contribute and show, share a little bit of my story and how I ended up here.
Yeah, I'm sure you will. What actually brought you here? Why you chose the United States to develop your dental career? How did it all start?
Yeah, that's actually a good question. When I first moved to the US, this was 2015. I just had a plan to come over here and stay for 1 year. And so before that, just to rewind a little bit, um, I had this dream about coming and studying the US, had some post graduation or some experience abroad to enhance my dental career, my experience, have different perspectives or different points of view about how dentistry will be outside Brazil, where I'm originally from. And US was my first option, mainly because of English language, which I was fluent about. And when I was applying for ITI, I had multiple options that I could apply. It doesn't mean that I would be accepted on them, but I decided to apply for Harvard. I have this dream of studying Harvard, obviously, as everyone in the academic career had this dream about it. So I made some networking. I did some work as well and collaborations ahead of time. And I was able to, had opportunity to apply and was very competitive as well, since they had only one spot for the whole world applying for the ITI scholarship there. And I was selected. So I was grateful for that. But my plans were really to come over here, stay for 1 year, and get back to Brazil. So, and the course that took me to stay here, it's maybe the fun part of the journey.
Yeah, I'm sure, but let's elaborate a little bit more for people that don't know what ITI is. It's a scholarship.
So ITI is an international team of implantologists, is the biggest foundation in implant dentistry in the world, dental implants, obviously. And they support young clinicians to study abroad, to have this educational experience. They have multiple centers throughout the world. I think it's about 24, 25 centers. Even now, Tufts is one of the center again, in which I'm in charge with Dr. Ed. And so the experience in ITI, again, it's a worldwide network. They have study clubs, they have research grants. They have their own world meetings, national meetings, local meetings. They have their young clinician section as well. There are really multiple layers of things going on. So yeah, ITI, for people who don't know, it's International Team of Implantologists, is the biggest is the biggest implant dentistry foundation in the world, with the biggest numbers of members. And the idea of ITI is to have not only the educational perspective as the ITI scholarship, but also they have found research. They have the research grant division for membership. They have local study clubs, they have national congress, international congresses. So it's really this huge international network of people related to implant dentistry, in which we have prosthodontists, we have lab technicians, we have periodontists, oral surgeons, general dentists, all collaborating from each other. They have their own treatment guides, their consensus. So it's really a big community. And the scholarship, it's been on for, I think, more than 20 years. Um, and the ITI scholarship has been a huge opportunity for young clinicians that are intending to have this international exchange. And the good thing about it, I have so many people contacting me asking about this because it's funded, so we can get paid for that, and you don't pay tuition for this experience. So it's really amazing considering that, in the US, we usually have to pay tuition, we usually pay fees, we will pay that, and we obviously don't get paid to study here in most of the states and most of these universities. So it's really a unique opportunity, especially when you talk about private universities like Tufts University, Harvard, Michigan, all UCLA. These universities are all expensive, and they ITI gives opportunity for these clinicians to apply, and so it's being more and more competitive. Or I would say for the past 10 years, it's getting more competitive every year. A lot of people became aware of it, and now the ITI network has thousands of people throughout the world, and they're all applying to different centers.
That's interesting. So the background that you need to have in order to apply, you should have at least some training on implants. I understand that. Like either you have to be a periodontist or a prosthodontist or somebody with implant experience to be competitive to apply.
Yeah, yeah.
Okay.
Actually, it depends upon each center. Some centers are more research focused, some are more clinic focused. I would say most of them, they require at least a residency or specialist level. That if you have a master's degree, PhD level, you get more competitive depending upon your research background. Research background is important because every IT center, it is required uh, for students to proceed and perform research. So if you have previous publication, and it's interesting that you apply to a center that is lined up to your field of work. So if you work with digital dentistry, then apply for those centers that are more focused on that. Or if you focus with tissue engineering, maybe those centers that are more focused on that specific ones. And it's been
How
great.
can somebody find out that information? Is that all on the ITI website?
ITI, yeah, just iti.org, and our information is out there. You obviously need to be an ITI member to apply for the ITI scholarship. But other than the membership, I mean, you don't really need to have anything extra. And the selection process is from the ITI headquarter, and it's two phases, and then the ITI centers. And I think, I mean, it's a great opportunity.
It was surely an opportunity for you because you haven't mentioned yet, but you already were a periodontist in Brazil. So you have
Yeah.
completed your specialty and you were very involved with research and academic dentistry back there. So for someone
Yeah.
like you that, you already had so many years invested on education in Brazil, it was a big commitment saying, I'm going to just give up everything and go back to another country. So I guess ITI afford you that opportunity to come with an income so you could explore. So you had in mind coming for a year and then going back? Is that what was in your head before?
Yeah, definitely. That was my plan.
And what happened?
Yeah, what happened, right? I'm still here. So, my journey is so what happened is that when I came over here, I was within the first 6 months in Boston, and I got married 6 months before moving to Boston. And while I was applying, I was proceeding with the ITI scholarship. I was at Harvard, start doing my things, seeing my patients. My wife, who is a dentist as well, she applied for a residency program at Mass General Hospital in orofacial pain. So she applied for that, and again, she's been working with this field, for a long time. And so 6 months after we're here, she got accepted in this residency program at MGH, and and it was a 2-year program. And then when she got accepted, we decided to stay because I supported her the same way that she supported me when I first came. But after that, I had to find a way to stay here, and so I could either extend my ITI scholarship or my fellowship. at Harvard, or I could move on again doing another residency in the U.S. Um, uh, but at that time, I wasn't so sure if I wanted to stay in the US as well. So I didn't want to commit into a residency. And so I rather prefer to initially extend my ITI scholarship for another year. And this is what I've done. So I spoke with Dr. Galucci, and he was super supportive. He's amazing. And he told me, Andre, you can stay here for another year or so, and then we'll see how things going to go. Um, and in the meantime, we have this opportunity where Dr. H.B. Weber, who was the former department chair at Tufts University, prosthodontic department at Tufts University, approached me and told me, Andre, we're going to open up a position for a faculty, full-time faculty at Tufts University. And the position really fits your profile. I was like, oh, really? Because my profile is very unique. So are you sure? It was like, no, I'm sure you should apply, look into this. So I start looking to it, and actually the position, it was really perfect for my experience. And and my journey is interesting because I'm a periodontist. I came from a perio department in Brazil where I was very engaged with research and perio treatment. And then I moved to US as an ITI scholarship at Harvard, where I was in the implant program. Uh, mostly then having a little bit of pros and implants. and in a later point, I ended up becoming a faculty in the pros department. So this transition was very interesting throughout my career, and where I ended up, it just enhanced my whole experience as a dentist, and as I see dentistry. So it's very interesting. So in December 2016, after a year and a half as an ITI scholar, I became a faculty at Tufts University, and that's where I am since then. It's been almost 4 years.
It's been a great experience, and it's great to have you in our department. And as you said, I think it's very unique. And I hope that a lot of programs and a lot of prosthodontic departments are moving in the same direction. And maybe periodontal departments will be moving in the direction of having prosthodontic faculty to teach these very cross concepts that actually don't fit into one specialty only. And I guess that's the uniqueness of any implant program, or in this case, the ITI scholarship that you engage. You had a heavy load on prosthodontics,
Yeah.
right?
Yeah, exactly. So, one of the main challenges that I had when I moved to Boston was not only language barrier, and the whole new system, software. So we started seeing patients like 3 months after I got here. So it was a whole new challenge treating patients under English language. And I believe if you're not, I mean, I don't know, but it depends upon where you're from. But in Brazil, I mean, Portuguese language is pretty much dominant. We don't speak in English in a daily basis, neither with patients, neither with colleagues. I know that certain countries, English is a little bit more intrinsic in their culture, but in our country is a huge country, and we mainly speak Portuguese. So to me, having this switch button that's, oh, now you're going to speak with patients and colleagues only in English, and all these terminologies, and trying to explaining to the patient the treatment in a laid a version, in a laid language, it was quite challenging for me. But obviously, this is why also having a previous experience played a very important role in the process, because I was very aware of a lot of the steps. Um, but aside from that, the pros exposure was huge. So I learned a lot of prosthodontics, and not that I had a chance to apply everything, but conceptually, and also a lot of digital dentistry. And this was a key point, a key learning to me that opened up opportunities for me in a later point for to become a faculty.
Absolutely. And I wonder, from your experience in Brazil, considering the challenges of the language, which you knew that that was something that it will set you back a little bit at the beginning, do you think your dental education in Brazil helped you be competitive, or which part of your development in Brazil make you the most competitive when you apply for ITI? What made that difference?
Yeah. So number one is that dentistry in Brazil, it's extremely competitive. We have literally 20% of the dentists from all over the world in Brazil. We're the country with the biggest number of dental schools in Brazil. So it's very competitive. And I would say the competition started even before getting to dental school, since once the public schools are very competitive in Brazil, it's just 10% of all the dental schools dental schools in the country. So I would say the funnel started over there when I got into a public dental school that was highly competitive. And then throughout my career, trying to do some research during the dental school was extremely important. So I have a chance to do research even throughout my dental education. But I would say none of this will be relevant if I didn't have a mentor. So I had a person who was my mentor, and Dr. Mauricio Araújo, and he was the guy who brought me to the next level. So I owe him everything in that regards, because he showed me, the path that I should follow in dentistry, and the path that for a higher uh, level in dentistry. And once you see that path, once you see a master clinician and researcher performing, and you have someone like him as a mentor, um, then your whole world opens to this new a level, and it's very hard for you to accept anything lower than that. So this was maybe the most amazing thing of my career, and having this exposure to a someone that can amaze you in regards to the level of dentistry and the level of question. He was not only a master, he is now not only a master clinician, but also a master researcher, where he questioned every single step on the way. And I learned this from him, to question every single step on the way. Like, why are we doing this? Is this the most predictable option? Uh, how is the best way to excel this treatment? So this really was the turning point to my career, and this is what I think it made a huge difference.
Did he advise you to get involved with ITI or to come to the US?
Yeah, so Mauricio was highly engaged with ITI at that time. He was actually the ITI chairman, and at that time, and he was very involved worldwide with ITI as well. So he opened up opportunity for me to apply, giving recommendation letters and support. And not only to me, it was very interesting, because after me, my dental school, which is it's a small dental school in Brazil, we have already two other ITI scholars, Romulo, who went to Germany. We have Rafael, who went to Bern with Dr. Boozer. We have Vitor, who wasn't an ITI scholar, but an osteology research scholar that went to Zurich. So for such a small university, um, we can see the level of dentistry and these are only a few examples. There are many other students from there that had experience worldwide, and also other, very high level education. But we can see how an influence of, mentors and faculties in a high level, they can enhance the whole experience.
Yeah, and propagate, feeling like you have so much to give that you really want your people to do better, which I think it's the power of a mentor. When somebody really has intentions of seeing their people growing without selfishness or without competitivity, especially in a competitive environment. I'm sure that it's not that it shouldn't be. I'm sure it's not easy to find good mentors. In general, it's not, but in a competitive environment, it might be more difficult too. Do you feel it was difficult for you to find that good mentor in Brazil?
No, to me it wasn't difficult actually because to be very honest, because Mauricio, he was an influence in my he actually one of the person who influenced me to do dentistry, and this is because he's a relative. He's married with my aunt. So he had a huge influence in my whole life, personal life as well. And after that, but I would say it is challenging to find a mentor, a good mentor, and it's even challenger to be open to accept the mentorship. And I think this is maybe one of the most challenging part is because it's not only finding a mentor, but for the mentor to find a mentee that will be open for learning. And it's painful. The process is painful. You get criticized, you get hit bad. You work very, very hard in something, and then next day everything is just you feel that it falls apart because it's not good enough, and you question yourself where the mistake was. What's wrong, and we just can't see. So it takes time, and true mentor, in my opinion, are the ones that give you that time to learn by yourself. And this was not only Mauricio, but Dr. Galucci as well was like this. And Galucci was joking about when I went to Harvard that he had to deprogram me because I went as a periodontist, and he was like, "Oh, we have to deprogram Andre." And I was like, in the beginning, I was like, what is he talking about?" And
Perfect the way I am. What do you mean?
yeah, and now I clearly see what he mean about that. I mean, deprogramming is really opening up our mind to a new experience and a whole new level of view of perspective. And this, as if you're not open to hear what they say, and trust me, we all a little bit stubborn. We all feel when you don't have a view of what is about to come, or when you don't have your mind open or truly open, even though you say, it's very, very difficult for you to absorb the knowledge and having that as an understanding. So that's why I was grateful for my mentors, because they're not only master clinicians and researchers, but they also gave me a time to me, and they didn't quit on me. They persisted, because the mentors, they can quit on you. There's like, oh, this guy is hopeless. I mean, but they didn't. They persisted, and they gave me a chance, and they gave me a time to see through. And we keep evolving. Even now, as a mentor, we have students, and we're mentors. We keep evolving. We keep learning. I keep learning from my residents, from my students, and I still keep learning from my former mentors. And it's just a process that keeps evolving and keeps growing. And and I think the key point here is really to make sure that we don't block our mind to new things. And we have a tendency, once we finish studying, we start teaching, and you think that's the truth, this is what we should do. And it's even harder now for us to absorb a new knowledge and to keep our mind open.
I guess having that curious mind. And it's interesting you mentioned that Dr. Galucci told you the programming part, because what I tell my residents is something similar. I always tell them when they start, you have to give up everything you know now, with the hope and trust that what you have ahead of you to learn is bigger. In these 3 years, the only thing I ask them is give up everything you know. You'll be able to get it back later. Nobody will steal it from you, right? Whatever you leave it is going to stay there. But the opportunity to learn, and then building solid foundations of something new. Then you can always go back to your old things and fit the ones that actually make sense in this new format. That this openness to learn and this openness to receive is difficult, especially as you get older. And maybe for those out there that are thinking on all the transition that it will take to even come to a new country, there is going to be a lot of new. Basically, everything is going to be a new.
Yeah.
Yeah, professionally and personally. And you talk a little bit about the challenges with the language when you came here. Do you remember any other cultural shock or challenge that particularly impact you when you came to the US at first?
In terms of dentistry, you're saying?
In terms of personal or dentistry?
Yeah, in dentistry, I was shocked by how organized everything it is compared to Brazil. So, dentist school, and I don't know. I mean, this was my based it on my experience. I was really shocked about how organized and how everything was well. Everyone was well prepared for everything, and also how respectful uh, dentistry is as a career here in this country, which I believe is something that is lacking a lot in Brazil. So I wish people had more respect about those people who spend, 10 years throughout this career, including dental school, including sometimes college degree, dental school, and specialty programs, sometimes masters, PhD. And then when you go out and practice, they don't give a value. So it's something that I really felt it was different here. They understand that you went through this process and they respect you for that. So that's an amazing part of it. Other than that, I think Boston is so diverse culturally, and I had a chance to learn about so many different cultures, people. So in that sense, it was really I didn't get surprised, but it was just an amazing. Still, I amazed me by how much I learned from people from different parts of the world living in Boston. So this is the beauty of this place as well.
And when you came for ITI, did they sponsor you a visa?
Yeah, so I came with a J1 visa, which is a research scholar, and that visa is amazing actually because it's not very bureaucratic. It's easy. It allows you to extend if needed. So it's really a good type of visa for people who are aiming to come for this purpose.
And then for transitioning to where you at right now, did you had to transition? You cannot work with that visa, right?
Yeah, so there is a way that we can work under J1. There is a way that we can depending upon where you should transition to work. Because I was already paid, so you're allowed to get paid using that visa. But there's a way that you can get paid as a exchanger or fellow or something like that, even having different positions. Um, but obviously, the ultimate goal, if you're aiming to stay in this country, will be switching to an H1B visa, which I didn't have to go through because we ended up applying for green card even before that. Um, so that was the process that we went through, applying for green card through actually my wife. And then after 2 years, we ended up getting granted. So I didn't have to go through these transition to H1B visa. But if you're aiming to stay here, I would say the first goal will be trying to switch for H1B because that's a stronger visa and will give you more opportunities.
That's great. That's a great advice. It's maybe something that many people don't know that they have that opportunity, and also whether the direction of one visa versus another will be conducted or not to green card, which I think is a key question if you want to stay here.
Yeah. Exactly. If you're in a J1, you can do that still, but it's more challenging. H1B is definitely a stronger visa to apply for green card. What you cannot do is that if you're under an F visa, which is a student visa, this is as far as I know. I mean, I have limited knowledge about this, but in my experience, but F visa is a little limited, so I don't think you're allowed to apply for green card with that F visa. But other than that, it should be fine.
Probably not. So going back to then when you decided to stay, what happened? What were your options? You said, you know what, like I stay first for another year, so my wife finishes her program, and then when did you guys took the decision as a family? Okay, we're staying.
Yeah, this was very interesting. So yeah, I have everything lined up to go back to Brazil. I was aiming to apply for a PhD program. A I have a private practice that I was working that was on hold there. Um, And yeah, I mean, when my wife she got accepted, I pretty much gave up everything initially, and obviously, I mean, I have to support her, and her program was amazing. So it's a great opportunity for her, even more than what I was having. So, so yeah, initially we thought about going throughout those 2 years and see where we're gonna be once she finish her program. And my wife, she has her own also path that she went through, and so um, we after so at that time I applied for some jobs. I was looking for some jobs, and at the same time I was actually looking to apply for residency, which would allow me or open up opportunities for me to stay here if that was my ultimate goal, which I wasn't so sure very much at that time. Um, but doing a residency here, we will definitely open up more opportunities and will allow you to work in a few countries. But I had no dental boards. I had nothing done at that time. I had like basically no plan. So I start searching both sides. And this is how interesting here as well, how you can, fluctuate from faculty to going back to school and as a resident very easily. With so I was seriously aiming to apply for residency, maybe somewhere that is not very expensive, that I could maybe pay off very soon. But since my wife, once my wife was in Boston, was very difficult because all the schools here in Boston were private. So I was more leaning towards either staying as a fellow or maybe applying for a job, which I
Job
was.
in teaching, right?
Yes, applying a job as a faculty based upon my previous experience, even though it would be challenging considering that my residency program was from Brazil. And the turning point was really the opportunity that opened up at Tufts, um, and I know that some people apply for that position, but based upon my experience, the whole mixture of exposure that I had in my career, this gave me this opportunity, and I ended up getting the job. And since yeah, and then when I started at Tufts, I thought, okay, my wife is gonna finish up in a year or so. We're gonna see where we are, and we go from there. So when my wife finished her program, we I was well established as a faculty at Tufts. So I told her, already prefer to stay. And then my wife was already thinking about getting her DMD as well in order to work. And that's what she aimed for. She started to apply for an international program, um, for an IS program in different dental schools. And this is what she has done. In the meantime, we had our son Daniel. So she put on hold her career for a little bit, for almost 2 years, which was actually the best option. So and she's at Harvard. She's doing a her international program there, which is not an official program, but because she graduated from there, she had the opportunity to apply. But she got accepted at BU as well. So she was initially aiming to go to BU, but she ended up deciding going to Harvard afterwards. And that's where she's been. So she's in the middle of the process to get her DMD, and then we'll maybe reevaluate in a few years from now to see. But right now, our son was born here. Our whole career is here, so everything is really well established for us here.
I think your story and your wife's story tell really how many opportunities are in this country. As a dentist, you really can take many paths, and there is no an A, B, C, D order on how you enter in the system. But it's so important that entrance. I think once you are in the system, you start seeing all of the opportunities and
Yeah.
all the possibilities, because it's kind of overwhelming thinking about all of the things that you can possibly do or not do. And also depending of the state you are, which makes things very unique and different, the where you want to work, because perhaps with your experience in Brazil, your specialty in Brazil, you couldn't work here as a periodontist. So you need to have something. You couldn't even just come and teach. You have to have like some experience here to then get inserted on the teaching system, which is what happened to you. The ITI afford you the opportunity to be here, collect some experiences that make you perfect fit for a job position. And then you could open other things versus her who did something, or facial pain is what she did, right?
Yes.
Is that a recognized specialty, or it's one of the
Yeah, now, yeah, it became a record quota accredited. Sorry, it's a recognized specialty. Also, her program was quota accredited. Actually, they became a specialty April this year, so it was the latest specialty that became recognized by ABA.
which I
So
think is great. It's one of those specialties that people need to be aware of, like anesthesiology, is that it's really other paths for dentists that out there that you could practice in some states with that because it's a recognized specialty.
true, that's true as well. She could potentially apply for licensure, for license in some states throughout the U.S. Since we're in Boston, we didn't Boston. We're in Massachusetts. We're not able to. So that's why she decided to go for that career. But I would say some states, maybe Texas, I would say, or some few other Washington. If we're aiming, if we're flexible in moving, maybe she wouldn't have to go through this IS program.
Out of I know that it's kind of maybe a big like statement saying out of all the things that you've been through and out of all of the situations and obstacles, which one are you the most proud of overcoming?
That's a good question. Yeah, there's so many challenges on the way. I would say the biggest challenge is really just not being in your home country. And to me, this is the biggest obstacle. Uh, language is challenging, but you get used to it. The dental boards are very challenging, but you get over that at one point. Going back to study, doing a few steps back, it is challenging. You feel like sometimes you're stepping backward instead of forward initially, but um, and these are all challenges, but I would say the biggest challenge is being in a foreign country. Is getting used to the culture, to the people, and see yourself living here. And this is my main challenge. Dentistry is not the challenge, to be very honest. Dentistry is the easiest part, I would say. But getting used to live here and be far from your family if they haven't moved with you. Maybe this is the biggest challenge to at least to us, I would say.
Yeah. And I guess that's something that unless you bring your family with you, you will not be able to fully overcome, right?
Exactly. Yeah.
Well, if you could think about doing one thing different, and I know this is also a tricky question because we learn from our mistakes and all that. Is there anything that you think that if you had done differently, things would have been a little bit easier for you somehow?
Oh yeah, definitely. I, I, as I told you initially, I wasn't planning to stay here. So if I knew that I would stay here, I would have done many things differently. Um,
For
including,
example, anything in particular?
yes, I think I would have maybe study a little bit more the language. I would have done, maybe a higher score on TOEFL or IELTS, whatever, to make sure this wouldn't be a struggle when it got closer to when I first came. Maybe this was the very initial steps. And then later, I don't know, getting some dental boards done, start studying for the boards, getting more, more prepared for the system, for this application system here that is very complex and is not very friendly, which I had no idea. I and and understanding as well how dentistry works here, if that fits for you or not, because it doesn't mean that I wasn't thinking about staying, but now that I'm here, we have to learn all these things that it relates to our profession here. So yeah, my advice will be if you're planning to move and stay, definitely you have more time to get yourself ready for the reality in the US or in whatever country you want to move into it, other than just figuring it out throughout the way, which is not what I would recommend.
Well, I think the key point is knowing ahead of time. And the more you know, of course, the more empowered you'll be when you take your decisions. But there are some things along the way that you just discover of and you'll find out. But you talked about a few things that I think are super important. One is the national boards. They're super difficult, especially part one. And we talked about this before because we share the same experience that I had a very traumatic experience myself with
Yeah.
part one. So it takes time. It takes time. And the longer you wait for doing those things, the harder will be because the less prepared you'll be to sit down and study
Yeah.
and commit to the time. But I think having that ahead of time is a good advice. But and now a little bit to close for all those international dentists out there, maybe dentists from Brazil that are thinking whether this is going to be the right fit. Are they considering coming here, thinking on all of the challenges and the little step back that will represent for them personally and professionally? What piece of advice will you give them?
Uh, Plan ahead of time. This will be my main point, as you mentioned as well. Um, I would say make sure that you, before jumping to moving to the US, understand the process, understand what would require you to stay here, and understand that what your goals are specifically, because I have so many colleagues that ask me about this, like, oh, I want to move to the US. But then it's like, what is your goal? What you're aiming for? And depending, because you really depending upon your aim, sometimes your path is going to be differently, depending upon your past experience, your path is going to be differently as well. So understanding the different paths, understanding the school system here, understanding the visa process as well, and also understanding that you're gonna be living in a foreign country, which with a different culture, and with a different people, different reality. I think it's really a key point for and a good piece of advice that I would give for people willing to come, plan ahead of time, understand the process, and understand your path. Because once you come in, you don't have a time to choose. You need to move and you need to get things going. And there's a lot of things that can be a setback if you don't plan ahead of time.
Yeah, that's a great advice. That I think we could all use a little bit more preparation if we know where we're heading ourselves into. But that's
Yeah,
great.
definitely. Yeah.
Yeah. Well, thank you so much. Is there anything else you would like to share? If people would like to connect with you or hear more from you or ask you advice, maybe they connected with you and they feel you could be a good mentor. What's the best way of reaching out and connecting with you?
Yeah, so first I want to thank you very much, Dr. Lagreca, for this opportunity and all your questions. They come up with the aim of this podcast, which is showing people throughout the world how our experience was and what kind of advice we can give. For those ones who wants to reach out to me, I mean, I have my social media on Instagram account, which is Dr. André De Souza. You can find me easily, or my email account as well. From Tufts, you can easily find my profile on Google and my email account there. Um, or you can find me on Facebook as well. So it's not really hard to find me.
I'll make sure I leave all the contact information in the description box for people to reach out.
Thank you, thank you. But thank you for the opportunity, and for everyone willing to move and willing to pursue a career in the U.S. I wish all the best, and let us know if they need any piece of advice or help.
Thank you so much for that.